Sauroptic mange, commonly it is known as ear mange, and in case of sheep and goat, the Sauroptic tuniculae and the Sauroptic capre. Sauroptic capre it is the male mite. Tuniculae mite generally invading into the ear canal of the kids or small goat. So this invasion of this particular mite in the ear canal, we can see whenever we go for the typical or detailed examination of the ear canal. So at that time, we can see there is a yellowish waxy material or there is a typical smell it can be occur from the ear of animal. And such animal, they are having the constant itching or constant shaking of the head, it is there. Or such animal, they are scratching their ears with the help of mouth or with the help of their foreleg or hand leg. So there is a head shaking, ear scratching, and there is a accumulation of some cerumen in the ear canal, you can see, or formation of crust or alopecia at the ear pinna. So here we can see, so it is called as a ear mange. So the sauroptic mange, it is known as the ear mange because in this disease, lesions, they are very much difficult to the periphery. Sometimes there is confusion between zinc deficiency and sauroptic mange. In zinc deficiency, there is a illimited grayish thick type of lesions are there. While in case of sauroptic mange, shallow type of superficial lesion we can see in the sauroptic mange. There is a sometimes there are chances of otitis media or interna we can see in case of the secondary infection. So here we can see this is the typical case of sauroptic capre infestation, in which we can see there is a scale, allopathic patches, typically on the ear, periphery. So here, periphery of the ear, it is affected one. Sometimes such animals, they are having concurrent fungal infection also. So here in this picture, we can see tail of the animal, or at the periphery of the tail, we can see typical crusty type of allopathic lesion. And such animal, they are having itching. Whenever there is no treatment, it is given, itching, it can be occur. Then these sauroptic diseases, we can differentiate it from again sarcoptic mange or zinc responsive dermatitis. We can give number of options for the treatment in case of the mange. So we can go for the cypermethrin or permethrin at the dose rate of 4 ml per liter. So any preparations which are available in the market, which is containing permethrin or cypermethrin, it can be given at an interval of 7 to 10 days. Or these lime sulfur dips. So it is very approved type of treatment in case of the treatment of the mange. So this hot sulfur lime dip 2 to 4%, it is given continuously for a period of 5 days. And after that, it can be given weekly. So weekly treatment it is necessary, but at the start of the treatment, when there are more severe lesions are there, we can go for the sulfur dip or sulfur spray for a period of continuous 5 days, and after that you can continue at the weekly interval for a period of 3 to 4 doses are necessary. Or we can go for the injection ivermectin or doramectin. So whatever the preparations which are available in the market, so it can be given at the dose rate of 200 microgram per kg body weight or 0.2 milligram per kg body weight subcutaneous at the weekly interval it is given. Again, it requires 3 to 4 weeks doses. But sometime there due to the frequent use of this ivermectin and doramectin, there is a resistance it can be occur. So for that purpose, we can go for the alternative therapy with the neem oil and currants oil. So locally we can apply this oil and it will give very good result. Or simply whatever the available material are there. So aloe vera paste. So just you have to clean one aloe vera plant part and you have to make the paste, and that paste it will also act as an anti-inflammatory and anti-bactericidal action. Or simply povidone iodine 1 to 2% it can be given. And in case of the secondary bacterial infection, like in case of sarcoptic or demotic mange, we can go for the broad spectrum antibiotics like endofloxacin, ciprofloxacin, or tetracycline we can give for a period of 3 to 5 months. And most important, separation of animal from other animal. So in case of mange, it is very contagious nature type of disease. So you have to isolate the affected animal and you have to go for the treatment of such affected animal. So most of the time when the mange it is there, we are only concentrating on the affected animal. But what about the environment? Because in environment, disinfection, it is also important one. So spraying of the shades and in and around area, the chlorhexidine or sodium hypochlorite, it is very essential. for the removal of this mange. So thank you one and all.